Here are some important things to know about OCD and suicide. The risk of suicidal ideation and attempts in OCD is not insignificant. In fact, people with OCD may have a higher risk of suicidality than the general population. Among those with OCD, people with a history of trauma will have thoughts they regard as unacceptable concerning aggression, sexuality, or religion that may put them at particularly high risk. It's an unfortunate myth that people with OCD aren't suicidal because they can't make up their minds about how to do it. The presence of substance and alcohol abuse increases suicidal risk for people with OCD, just like for anyone else. Talking about suicide should always be taken seriously. If you're concerned about the safety of someone with OCD, get help immediately through your community's emergency services or from qualified mental health professionals. If someone you care about has OCD, it can be hard to understand some of the thoughts they experience. Sometimes people with OCD may have thoughts about hurting themselves or dying, but that doesn't mean they actually want to act on them or are really going to do anything. They're just part of the condition, intrusive, frightening thoughts. At the same time, it's possible for someone to have real suicidal thoughts, and that's when we need to pay close attention. Signs for family and loved ones to notice include changes in mood or behavior, talking about life being meaningless, history of suicidal thoughts or attempts, the presence of other mental health conditions like depression, bipolar disorder, or substance abuse, or feeling isolated and one doesn't have any support. When there's a real risk, it's important to act quickly, create safety plans, involve professionals, and make sure the person is protected.